Hi everyone, I'm Dr. Stephen-Claude Hyatt. I'm a clinical health psychologist and traumatologist, and I'm the managing partner at Cognitive Assurance Life Management International. That's CALM International. Wellness begins with you. Now, the last time we talked a bit about stress and mental illness, and we looked at two concepts: predisposition and stress diathesis model. And basically what we said is that if someone has a predisposition for a mental illness, that is, they have inherited the genes for mental illness, if there is a stressful situation in their lives, then that can trigger or activate mental illness. Now, I got some questions from a few viewers, and thank you much for those questions. And I want to address two of those questions today. And then I want to teach you another technique to help you to relax and deal with stress. The first question I got was someone asking if personality disorders are also inherited. Now, in order to answer that, I have to explain to you that we have two types of mental illnesses. We have what we call Axis 1 mental illnesses and Axis 2 mental illnesses. Axis 1 mental illnesses are all mental illnesses except personality disorders. So mood disorders, anxiety disorders, psychotic illnesses, developmental issues like ADHD and the autistic spectrum disorder, learning disabilities, etc. They all fall under Axis 1. Axis 2 diagnoses are personality disorders. So borderline personality disorder, histrionic personality disorder, obsessive compulsive personality disorder, narcissistic personality disorder, and I think we all know someone, a world leader who shall remain nameless, who they think has this type of personality disorder. All of these and other types of personality disorders will be considered Axis 2 diagnosis. Axis 1 diagnoses are hereditary. So if we have a predisposition for a mental illness, then we can develop an Axis 1 diagnosis. Axis 2 diagnoses, personality disorders, are not hereditary. They are developed based on our environment. So this gets us into the nature-nurture debate, as in what influences outcomes in human beings. Is it more nature or genetic makeup, or nurture, the environment that we were brought up in? Where personality disorders are concerned, it's primarily nurture, the environment that you're brought up in. So if persons are brought up in an environment that, for example, is more loose and relaxed, not a lot of rules, no measures put in place to direct the individual, especially a child, what are expected outcomes, behaviors that are acceptable, unacceptable, then that child can develop what we call ODD, which is a disorder that we see in children that surrounds conduct. So oppositional defiant disorder, ODD, or CD, conduct disorder. Yep, so I hope that answers the question. The second question that I was posed was, is it easier to treat a mental illness if someone has their first episode earlier in life or later in life? The answer is that it doesn't matter really, whether it's earlier or later. What is important is the type of treatment that the person gets, and that the person gets treatment as soon as they manifest for the first time. If we delay that treatment, then the condition worsens and it makes it more difficult to treat that individual successfully, especially depending on the diagnostic profile of the person. All right, so much for questions. I want to now get into, before the time is up, this other technique that I want to teach you to help with stress and anxiety, and it's called imagery. Yeah, imagery, because we're going to begin using our minds to help our bodies to relax. It's called psychosomatism. Psycho comes from the Greek word psyche, which means mind, and somatic comes from the Greek word soma, which means body. And so psychosomatism speaks to how the mind affects the body. So before we begin, I want you to think about a place that you have been to that causes you to feel relaxed and comfortable and happy. It can be anywhere. It can be a walk on the beach, a mountain trail, a ski resort that you've been to. It can be a room in your home. It can be anywhere you want it to be, but it must be a place that you identify with that brings calm and comfort. For me, it's the beach close to where I grew up in St. Catherine, Jamaica. Now that you have that space that you're thinking of, I want you to find a comfortable position. It could be anywhere, lying down on your back or your side or your stomach, sitting up, but it must be a comfortable position. You could sit up and have your head down, have your head back, but just find that comfortable position. Now that you're in that position, I'm going to ask you to close your eyes, and I want you to picture that space in your mind's eye. What does it look like? Are there particular colors? The scenery? Envision that space. And I want you to interact with that space with your 5 senses. Not just the sights, but what are the sounds, the smells, the tastes, the feel of that space? And as you experience that space with your 5 senses, I want you to relax and just breathe. Breathe normally in and out, regularly in and out. And as you're feeling comfortable and safe and peaceful in that space, your arms are relaxing, your legs are relaxing, your body is relaxing, and your breathing is more relaxed. And just stay in that space for a while longer. What do you see? What can you feel on your body? Is it the wind? What are the smells? What can you hear? Be mindful of how relaxed and calm you feel. And I'll ask you to just stay there for a while longer as you experience it with your 5 senses. And whenever you are ready, just slowly open your eyes. You feel that? We call that imagery, the power of the mind to calm us. And we can do that anywhere, at any time. We can do it in the mornings when we wake up to help us to relax as we start our day. We can do it in the evenings before we go to bed. We can do it anytime throughout the day if we're feeling stressed or anxious. And that process can help us to just relax, to recenter, to focus. From all of us here at Calm International, we want to encourage you to continue to stay safe, continue to follow the laws where you are at with the lockdown or whatever you might call it. Continue to love each other and to look out for each other. And remember, this too shall pass. It will pass. Love each other, love yourselves. United we stand, divided we fall. Take care until next time.